Hello, I'm Dr. Neil Brown, Chief Medical Officer at K-Health. We do things a bit differently here, like empower people and clinicians with affordable, data-driven, accurate healthcare available from the comfort of their own homes. I may be from the old school, but this is the new way of doing healthcare, and I'm looking forward to telling you about it. Let's talk about the power of the K-Health Symptom Checker. So the K-Health Symptom Checker is very simple. You start with a symptom, and then the dialogue does the rest as it takes you through asking about a variety of different symptoms. All of the information provided by the symptom checker is based on millions of people like you. After you enter your information into the symptom checker, you get a treasure trove of information at the end. You get a list of conditions that you might have. You get a list of tests that people like you have taken. If there's a medication associated with a particular condition, it's going to tell you what the most common ones written are. And it'll also give you some symptoms to look for to make sure you're not getting worse. A lot of the cases that we see through the symptom checker are more common, straightforward cases, urinary tract infections and sinusitis. But the symptom checker is more than capable of also handling some much more complex complaints. There's an article that comes out every couple of months in the New York Times about an interesting case. And the case was about a gentleman who went to his doctor, was having some shortness of breath, wasn't feeling well. Doctors thought, well, you should see a pulmonologist. Pulmonologist thought maybe it's asthma. Really wasn't very sure, says maybe you should see a cardiologist. Cardiologist did some testing. Because the underlying cause was amyloidosis, the testing was abnormal, but for the wrong reasons, so the cardiologist decided to stick with asthma. The short of it is, continued to worsen, ends up in the hospital, ends up needing a heart transplant. When we put these same symptoms through the K-Health app, the result we got was congestive heart failure. This was a diagnosis that we would have picked up months in advance, and while the result would have still been a heart transplant, it would have saved a lot of time and a lot of grief for this person. What the New York Times article says simply is that doctors tend to see what they believe they're going to see. They reach conclusions based on what they're testing for and what they're looking for. The symptom checker doesn't do that. It takes everything into account in an unbiased way and gives you a result. K-Health is bringing you healthcare when you need it. Try it out today.